Scenario 1. A 55-year-old male smoker presents with crushing chest pain radiating to his left arm and diaphoresis. His ECG shows ST segment elevation in leads 2, 3, and AVF. Which of the following arteries is most likely occluded? A. Left anterior descending artery, LAD. B. Left circumflex artery, LCX. C. Right coronary artery, RCA. D. Left main coronary artery, LMCA. Answer: C. Right coronary artery, RCA. Explanation: this presentation is consistent with an inferior myocardial infarction, MI, which typically occurs due to occlusion of the RCA. It affects the inferior part of the heart, as indicated by ST segment elevation in leads 2, 3, and AVF. Scenario 2. A 30-year-old female presents with recurrent episodes of palpitations, anxiety, and lightheadedness. Her ECG during an episode reveals a narrow QRS complex tachycardia with no visible P waves. What is the most likely diagnosis? A. Atrial fibrillation. B. Ventricular tachycardia. C. Supraventricular tachycardia, SVT. D. Atrial flutter. Answer: C. Supraventricular tachycardia, SVT. Explanation: SVT often presents with narrow QRS complex tachycardia and no visible P waves on ECG. It typically originates above the ventricles, and episodes can be terminated with maneuvers like Valsalva or adenosine. Scenario 3. A 65-year-old male presents with intermittent claudication and absent pedal pulses in his right foot. His ankle brachial index, ABI, is 0.6 on the right side and 1.0 on the left side. What is the most likely diagnosis? A. Deep vein thrombosis, DVT. B. Popliteal artery aneurysm. C. Peripheral artery disease, PAD. D. Raynaud's disease. Answer: C. Peripheral artery disease, PAD. Explanation: the decreased ABI on the right side, 0.6, indicates a significant reduction in blood flow to the right lower extremity, consistent with peripheral artery disease. Absent pedal pulses and claudication further support this diagnosis. Scenario 4. A 35-year-old male with a history of intravenous drug use presents with fever, new-onset heart murmur, and splinter hemorrhages under the fingernails. What is the most likely diagnosis? A. Bacterial endocarditis. B. Rheumatic heart disease. C. Aortic stenosis. D. Myocardial infarction. Answer: A. Bacterial endocarditis. Explanation: the clinical features, including fever, new heart murmur, and splinter hemorrhages, are indicative of bacterial endocarditis. Scenario 5. A 50-year-old female with a history of hypertension and diabetes presents with heart failure symptoms. Her echocardiogram shows a reduced ejection fraction, EF, of 25%. Which medication is most likely to improve her EF and reduce morbidity and mortality? A. Loop diuretics. B. Beta blockers. C. ACE inhibitors. D. Calcium channel blockers. Answer: B. Beta blockers. Explanation: beta blockers, such as carvedilol or metoprolol, have been shown to improve EF and reduce morbidity and mortality in heart failure patients with reduced EF, HFrEF. ACE inhibitors are also essential in this population, but beta blockers are often added for further benefit. Scenario 6. A 70-year-old male presents with recurrent episodes of paroxysmal atrial fibrillation. His CHA2DS2 VASC score is 3. What is the most appropriate treatment strategy to reduce the risk of stroke? A. Aspirin alone. B. Warfarin, Coumadin. C. Direct oral anticoagulant, DOAC. D. No anticoagulation therapy. Answer: C. Direct oral anticoagulant, DOAC. Explanation: the CHA2DS2 VASC score of 3 indicates a moderate to high risk of stroke in atrial fibrillation patients. In this case, a DOAC, such as apixaban or rivaroxaban, is the preferred anticoagulation therapy to reduce the risk of stroke. Scenario 7. A 45-year-old male presents with sudden onset chest pain radiating to his left arm and jaw. An ECG shows ST segment elevation in the anterior leads. The patient arrives at a facility without cardiac catheterization capabilities. What is the most appropriate initial management? A. Administer fibrinolytic therapy. B. Administer aspirin and admit for observation. C. Start anticoagulation with heparin. D. Arrange for immediate transfer to a PCI-capable facility. Answer. A. Administer fibrinolytic therapy. Explanation. In cases of STEMI where cardiac catheterization, PCI, is not immediately available, fibrinolytic therapy, such as alteplase or tenecteplase, should be administered promptly to dissolve the clot and restore blood flow to the occluded coronary artery.